Hi, good morning, everyone, and thank you for attending this WHS team briefing. Today, we will reviewing 3 new safety procedures. So, these procedures are essential to keeping both staff and guests safe, and they ensure our hotel meet WHS legislative requirement. So, I'm going to talk about the first one, spill management, the second one, chemical handling, and the last one, evacuation pathway. Yeah. So talk about the purpose of the meeting. Uh, so here are our subjective for today. Understand the 3 new WHS procedure, review change to WHS policy, identify update to hazard reporting, hear your feedback, and explain training and rollout timeline. So the first one, spill management, is focused on this includes the immediate spill reporting, proper cleanup method, and regular following inspection. Slip and fall accident are one of the most common injury in hospitality. So this procedure is essential. I would like to ask someone, should be Alex. So what is one area in the hotel where spill commonly occur?
That would be the lobby, the kitchen, and the housekeeping pantry.
Yes, thank you. Exactly. Those are priority area where we must be especially keep vigilant. So for the spill management training, so we should support this procedure. We will provide a spill response demonstration, instruction for using absorbent material, and guidance on when to notify maintenance. This will be rolled out within 2 weeks, and document will be available on the WHS Drive. So for the second procedure, improve safety around chemical handling. So staff must use the dilution station correctly, wear proper PPE, and follow update SDH sheet. So I'm gonna ask Nerina, could you please tell me one piece of PPE that must always be used when handling chemical?
There will be gloves, goggles, and also apron.
Yes, exactly. So PPE help prevent chemical injury and skin irritation. So for the chemical handling training, this training includes how to use the chemical dilution station, reading product label correctly, understanding safely data sheet, and proper PPE use. Training will be complete within 2 weeks, and the full procedure will be implemented in 3 weeks. So this procedure ensure our evacuation route remain clear. No boxes, trolley, bin, luggage, or equipment should block this pathway. Supervisor will now complete daily evacuation check. So for this question, I'm gonna ask Jasper. So could you please give me a sample of something that often end up blocking pathway?
There'll be laundry cart or storage box.
Yes, and we must ensure these items are never left in the emergency exit area. So for the evacuation pathway rollout, and to support this procedure, we will have an evacuation awareness section. This information add to staff induction and pathway check add to daily supervisor checklist. So rollout will be complete in 1 week. So WHS policy reporting update. So this new procedure require update. We will use new hazard reporting form. Incident reporting steps have been updated, and supervisor must monitor compliance. So for the non-compliant can result in corrective action as these are legislative requirements. So for the staff feedback, before we move forward, I would like to take a few minutes to gather your feedback. Your insight is really important because you are the one using this procedure every day. So does anyone have a question, suggestion, or concern regarding any of the new WHS procedure? So we have discussed. Okay, sometimes it take a moment to think about it. Let me make it easier with a quick question. So the first one, I will ask about the spill management to Nevina. So does does anyone want to share where the spill most commonly happen in your work area?
So I've noticed that spills happen most often near the coffee station in the lobby and also around the housekeeping storage area.
Thank you. That's really helpful. We will make sure spill kits are placed closer to those high-risk areas, and we will remind everyone to report spill immediately. So for the chemical handling and PPE procedure, I will ask Daphne. So any of you notice issue with the PPE availability or how chemical are being used?
I think that the gloves and face masks needs to be restocked more often because sometimes the PPE cabinet is nearly empty at the end of the shift.
Yep. So great observation. I will note that we need more regular PPE check and standing order so we don't run low again. For the evacuation pathway procedure, Alex, you notice block exit or area where evacuation routes are not clear?
Yes, I've seen housekeeping cars and laundry bags blocking the fire exit hallway, especially on busy turnover days.
Thank you for bringing that up. So we will remind every department to keep evacuation route completely clear, and we will monitor this more closely. So this is rollout timeline to summarize our rollout schedule. So we will start with the spill management procedure, which we will trial for the next 2 weeks. Chemical handling procedure will be monitored for the 3 weeks, and evacuation pathway for 1 week. Training for all staff is scheduled for this week. All documents related to this procedure are uploaded to the WHS drive, so you can access them anytime for the reference. This timeline will help us implement and monitor each procedure effectively, so making sure we improve safety across the workplace. So thank you for your participation today, Alex, Nelvina, Jasper, and Daphne. So this procedure are designed to keep everyone safe while ensuring our hotel meet WHS registration and industry standard. Please see me after the meeting if you have further questions. Thank you. Thank you, guys.